Food allergies are a real thing and often overlooked and undertreated in our pets. Here to tell us more is Dr. McNair from University Veterinary Hospital. Dr. McNair, thank you for joining us.
Hey, absolutely.
And we just said it's undertreated. How often are food allergies, involved with our pets?
It's pretty common, and especially in purebred dogs, which a lot of people tend to have. Food allergies are something that if we think about in a person, we tend to think somebody eats something, they get sick immediately, they're vomiting, they may have diarrhea or just feel unwell, or even have hives in severe cases and difficulty breathing. But that's really rare in our pets, and actually their manifestation of food allergy tends to be on their skin through, itch and chronic infections. We kind of even say, ears and rears, that dogs that chronically have ear disease or they're really itchy around their rectum or have a lot of redness there, those can be signs that that dog has a food allergy.
And so for humans, it's very apparent, as you had gone over the signs and symptoms, with pets, we can overlook those. And a lot of times what we think about, we're like, oh, well, I've been feeding my pet the same thing over and over again. How are they popping up now? Kind of talk about that.
Yeah, so food allergies take time to develop. You may think about somebody that as a kid, they could eat strawberries and now they can't go anywhere near them. It took chronic exposure to that to develop an allergy, and it's the same in our pets. I mean, most of our pets are going to have at least 2 to 3 months of consistent exposure to an allergy, and in fact, most of them, they've been on it for years.
Oof. I know for a lot of pet owners that's tough to hear that they could possibly have been dealing with these symptoms for years, but what is the treatment for pet allergies?
Yeah, so food allergies are ones that a change of diet's in order. A thorough diet history is very important because most veterinarians are going to reach for a novel protein or something that they've never seen, because if you've never seen it, you can't be allergic to it. So knowing what they've been on in the past is really important. The other thing is, when we're trying to confirm a food allergy, the best thing to do is be very selective about what they eat. So we're going to make sure no outside treats outside that diet. They're having on no flavored preventions like heartworm or flea and tick preventions that often have a flavoring, because that could be an allergen that you give once a month.
Okay, and then real quick, we're in the holiday season. You're going to have guests coming in. Everybody always goes towards the pets first thing, may feed them some stuff. What are some tips in order to keep them on that diet and to keep them away from things that could cause them harm?
Dedication. It's an important thing that if you guys are going to be eating, have the dog or cat out of the room. Kind of take that temptation away. Have them go eat in a different room so they're busy having fun, and there's no temptation to want to feed them those things.
Simple tip, but some great advice. Dr. McNair, thank you so much for joining us.
Absolutely, my pleasure.
And we want you to stick around, because up next, meteorologist Patrick Dennis is going to be back with a full check of your forecast.